Welcome! Today we're discussing the medication Lisinopril. Lisinopril is in the drug class of ACE inhibitors. This medication is also known under brand names as Pringril and Zestril. So, how does it work? ACE inhibitors dilate the blood vessels, lowering your blood pressure and improving the amount of blood your heart pumps. Lisinopril is indicated for chronic heart failure, hypertension, post-MI, renal protective, and diabetic nephropathy. Lisinopril is administered orally with a tablet or solution. Here are some possible side effects associated with this medication. Overdose is a possibility with Lisinopril. Chronic overdose can result in renal failure or organ damage. Overdose treatments for Lisinopril are available. Precautions should be taken with Lisinopril, especially if you are breastfeeding, are hypokalemic, have renal failure, chronic heart failure, aortic stenosis, or renal artery stenosis. Hypersensitivity is an exaggerated immune response which results in arthralgias, fever, and rash. And angioedema is a rapid swelling of the dermis, subcutaneous tissue, mucosa, and submucosal tissues. Lisinopril is considered Category C in the first trimester. There are inadequate studies on the risk to human fetuses, however they have found adverse fetal effects in animals. It is Category D in second and third trimester, and there is evidence of fetal effects including hypotension, neonatal skull, hypoplasia, anuria, reversible and irreversible renal failure, and death. Dosage adjustments need to be made for people with renal dysfunction and geriatric patients. A patient's white blood cell count, electrolyte levels, signs of angioedema, blood pressure, and any symptoms of chronic heart failure should be monitored while they are on this medication. There is a possibility of an allergic reaction. Patients should avoid a Lisinopril if they are allergic to other ACE inhibitors. If you miss a dose, take it as soon as possible. However, skip that dose if it is almost time for your next scheduled dose. Do not take an extra pill to make up for the missed one. High potassium diets should be avoided, and patients should not discontinue this medication without contacting their physician first. Patients should be notified that this drug is not a cure for hypertension or heart failure, and your patient must report a cough, pregnancy, or chance of getting pregnant before taking this medication. We hope you enjoyed learning about Lisinopril. We are open to any questions you may have. Thanks for your time.
Created using Powtoon.